Welcome. For those of you who haven't met me before, I'm Penelope Klein, and that's Dr. Klein. I am a physical therapist, and my degree is in education. So I was a professor for many years, taught at a number of physical therapy schools. So if you would look at my discipline in life, that I invested quite a bit of education and enthusiasm and experience in, it's therapeutic exercise of the West. That's what physical therapy is. What we do for therapeutic exercise to maintain optimal body function. And part of that is promoting wellness, but probably the major part of my career was spent in addressing chronic illnesses or traumatic illness, musculoskeletal, neuromuscular arthritis, even amputations, Parkinson's, multiple sclerosis. So we're looking at from a disease mentality. What's wrong with you? What can we do to help fix you from a Western medicine aspect? I was also a martial artist. So studied a number of years in karate and then judo, and discovered Tai Chi and Qigong, was very intrigued, curious about Tai Chi and Qigong for two reasons. One, it's a therapeutic exercise of the East, of Eastern medicine. So this was very nice. Also, I was a pretty high-level performer in judo, and with an older body that had lots of injuries. And so I needed to do something to help restore and heal and regenerate my body between practices. I got hurt more in practices than tournaments, but we're talking about maintaining the body that's really getting a lot of trauma to it. So I had a personal interest and I had a professional interest. And eventually I became just so passionate about the therapeutic benefits of Tai Chi and Qigong that became my main focus of study, and ended up doing a lot of continuing education for PTs and OTs and chiropractors and exercise science individuals, and how to integrate Tai Chi and Qigong into mainstream medicine. And I wasn't alone. As a matter of fact, I was joined by professionals at Mayo Clinic and Johns Hopkins, and more recently and publicly known, Harvard Medical School. So this is now what used to be alternative and thought of a little hocus pocus, is now being integrated into mainstream Western medicine. So what we're finding is we really didn't know much about Chinese medicine until the 1970s, when Nixon opened up relationships with China, and we were all astounded, those of us who were around at that time, old enough to be around, we were astounded by acupuncture. This idea that acupuncture could be used as an anesthetic. However, that was such a narrow definition and understanding of what acupuncture could really do. And when doctors of Chinese medicine would say, well, we can treat diseases with this, we kind of poo-pooed that. I'm not so sure about that. But the anesthetic part, people agreed to pretty quickly. Yes, it can do that. It took some time. It took some time to understand traditional Chinese medicine, and there were some barriers to the Western psyche. This idea, not so much disease-focused, but prevention and wellness. We were just beginning to think about that in Western medicine. Mostly we were into more, okay, you have an injury, you have a disease, what can we do to address that, manage it, cure it? Whereas the Chinese were looking at, how do I maintain the optimal functioning of this body? The body really knows how to heal. I get a cut, there's this extremely complicated process of how that heals. But I don't think about it at all. Every cell has the DNA mapping of what my body should be and how it should restore and heal itself. Every single cell. And so that happens. In a healthy body, it happens quickly. In a young body, it happens quickly. As we age, as our body gets threatened with toxins and we begin to function less, and we begin to age, that restorative energy, it declines. So we don't heal so fast. And now we always say the elderly, the frail, they're at risk of the flu, they're at risk of pneumonia, they're at risk of infection if they have some kind of surgery. We look at that. And it's really, if we think of aging, as the body is just slowed down this healing, restorative process that's in our DNA. If that's just slowed down, then that's really what aging is. So I have an articular surface in my knee here. When I move my knee gently, every day, there's a stimulation to those cells, and I'm moving it. If I do move it, as we do in Qigong, in the way it was meant to move, gently, and a pressure, a stimulation on the articular surface, then we get a normal, exactly what's supposed to happen, replenishing, restoration, and nourishing of the cells for the articular lining of that joint. When that doesn't happen, the alternative is arthritis, eroding of the articular surface, deformity in the joint, loss of function. So, this was a little bit of different thinking, doing things to maintain my body and keep it well, rather than addressing some injury or disease or trauma after it happens. But we're there now, aren't we, in Western medicine? Doesn't almost every HMO or health plan have preventative medicine as part of it? But we didn't. We didn't 20 years ago. Right. But we do now, because we realize this is where we need to be. This is the best model of medicine. So we've had this really neat thing happen. Hey, that was happening in my life too. We have this neat thing, Western medicine, Eastern medicine, interacted, took the best of both, and we actually have a new integrated medicine. It's still in the beginning. It's still in the beginning, but it's getting there. It's getting there. And you're here. You're part of it. Thousands aren't. Yeah. Thousands are at home. Thousands didn't come today. Wouldn't it be great if I was in some giant auditorium talking to thousands of people today? And they were all getting on board with this. But you're pioneers, and you'll talk to your family, and you'll talk to your friends, and that's how change occurs. You know, one person talks to another, and that change has occurred. And it is occurring in this country, in Western medicine. So, why the 24 Posture QiGong? Because that's what you're here to learn about, the 24 Posture QiGong. And when I got into this, I actually sat down with my husband when I realized I was starting to get pretty passionate about this. And I said, listen, I'm really interested in this. This is what I want to do now for my third career. And that means putting as much finance, you know, family finances. I'm going to talk to my partner and say, okay, I want to put money into this. I want to travel. I want to go study with people, which also means time away from home, emotional investment. And I want to put that much energy equal to what I put into getting my doctorate and become a tenured professor. I want to become that knowledgeable about this. And my husband said, okay, go for it. But that meant, you know, going and studying with people, traveling, and I did. And I then became a seeker. So I went and I trained, studied, read, who do I want to study with, who do I want to learn from, and went to China, actually presented over in China at an aging conference over there. Learned a lot. Went to California, up with the Redwoods in Humboldt County, up near Eureka. It was very special energy there. And studied with a very well-known Yang Zhuingming, leader in the field, and studied with Yang Yang, who works with the NIH and the Mayo Clinic, and also Harvard. So I studied with these teachers, and tried to find, well, what would I advocate? What do I see as really something that I can get behind, that I can teach and have great confidence to say, this I think is probably the best of the best. And lo and behold, I met George and the Wu Yi Ji Ha system and his teachers, and I found what I believe is the most superior, the one that I would advocate, and that is the 24 Posture QiGong. Now, I believe you've had a little bit of information about the background of the 24 Posture QiGong, and it's really developed from what would be ancient exercises by a grand master in martial arts, but also equally renowned as a doctor of Chinese medicine, and his son-in-law, who was also very well known as a doctor of Chinese medicine. And they looked from everything that they had learned in martial arts and all of the exercise they knew and everything they knew from traditional Chinese medicine, and it was over a number of years, came up with this codification, this 24, it started as 18 or 20, I don't know if it dropped to 18. It started as 18, went to 20?
Started as 20. After he passed away, one student dropped it to 18, which is now very popular.
And in China and other parts of the world, and Helen Wu, who's one of our teachers, his granddaughter, added some and brought it up to 24, which is what you will learn. So, what makes it optimal? Time. Time is important. So how much time do I put into something every day matters. It's one of the things that influences whether I will actually continue to do something. Can I fit it into my lifestyle? Is it something I can do? Do I feel confident that I can learn it and do it right? Is it something I can fit in? Is there benefit? Do I truly believe there's benefit? And can I do it every day and make it a part of my life? So it has those 17, 20 minutes a day. That's not a big investment. You know, we invest in our bodies. We don't even think about it, but we invest in our bodies every day. We brush our teeth. We eat, hopefully, for nutrition and not for self-gratification. We exercise in some way. We wash our bodies. We're concerned about hygiene so that we don't get infections. These are things we do to invest in our body every day. We breathe 8 to 12 times a minute. Our heart beats maybe 70 times a minute. And Tai Chi has a rhythm and a frequency and a dose. And it should be done about 5 to 7 times a week. And, you know, this investment of 17 to 20 minutes is not such a big thing if you look at it like that. This is how I invest in my body. I wouldn't get a car and not change the oil. I wouldn't spend $28,000 on a car and not maintain it. And yet, if I mess up with that car and I have the financial wherewithal, I can get another one. But this body, this is it. This is it. The other thing that's happened over these 20, 30 years is that our life expectancy has really increased. It's really increased. And I talk to my young college students and I say, you're going to live. Many of you in this room are going to live to be over 100. So what's your body going to be like? What is your life going to be like in your 80s and your 90s? And you can't start thinking about that when you're in your 70s. You've got to think about it as soon as you realize that's important. And then, you know, we do see people in their 80s and 90s who are active and contributing, and they're mentally alert, they're fully engaged in life. We don't have too many people that are like 10 years old and go, that's who I want to be when I'm 100. That's a whole new thing for us. But it's going to be, some of you, it's going to be a part of your life. And we know the younger generation, 2 generations below me, is absolutely a part of their life. So we got to get the message out there. I like to teach in college so I can get the message out to that generation. All right, 24 Posture QiGong. All right, we know it works. Doesn't take too much, and we know it's really important. So how does it work? What makes it different? If I run, I get a lot of benefits from that. I get cardiovascular benefit. I have a sense of well-being. We know that. I have a sense, it elevates my mood. And I actually get a little bit of a boost of immune. We know that. I also have the potential, if I already have some problems in my knees or my hips and my ankles, that I am prematurely wearing those joints out. So as much as many people like to jog, it's not right for everybody because there is a cost to it. So for some people, for some part of their life, it works well. But it's not enough. It doesn't get everything. If I do some forms of Tai Chi and Qigong, I get a mind-body connection if I've been trained well and invested in it. And it really is a learned relaxation. That doesn't always occur. I do get some balance improvement. And we know that I do get a boost in the immune system and a reduction in my inflammatory response. And I'm going to come back to that because that's really, really big, big, big news. This reduction in an inflammatory response. What I also get is Western thoughts about how to maintain health and Eastern thoughts in how to maintain health. So in my Western mode, in a very systematic way, I'm going to go joint by joint, and I'm going to do 4 movements one way, 4 movements another way, and every articular surface, all of the tendons, all of the ligaments around that joint are going to get this very gentle message, nourishing and nutrition. The nutrition and the nurturing and the stimulation to repair, to restore and repair, so that that joint can maintain optimal health. Even if I have some imbalance, an old shoulder injury, when I get down and I do the movements that affect the shoulder, I can repair and restore and heal old injuries, old imbalances. So I'm going to go right from the top of the head all the way down to the bottom. I'm also getting a massage to all of my all of my viscera, all of my organs, my liver, my kidneys, and my pancreas. And because of the turning and the squeezing, the closing, and then the opening and expanding, all of my viscera, all of my abdominal viscera is getting that ever so gentle, slow stimulation, which is going to improve the nourishment, the function, the clearing of toxins from all of those organs. Also, there's this other big organ we have. It's called the fascia. This is a connective tissue, and it surrounds every structure in the body, and it's continuous. So if you've ever seen the white kind of little stretchy thin film layer we see it in meat, that's fascia, that's connective tissue. Well, that is the whole body, and when we do the exercises in the 24 Posture QiGong, we're getting this very gentle stretch of that fascia, that connective tissue, which helps our body move, supports our viscera, supports our internal organs. So that in the whole body is getting that nice stretch. That doesn't happen when you jog or you just walk, or if I one by one try to move every muscle. And anyway, there's no functional movement for this unless you have some job where you're pulling a lever up. Everything we do, our bodies were meant to work in a spiral. If I reach for something, can you see that, what's happening? I reach for it and I pick it up. That's all spiral. Well, that fascia, that's a connective tissue that supports it. But my muscles wrap around. They're meant to work in an integrated fashion, not this. So to lift weights and practice this as an isolated muscle, it's going to take a lot to get every single muscle, every single joint, and am I really doing the best for my body? When an integrated spiral movement, that's a functional movement, that's the way my body was actually organized anatomically, then I'm going to get so much more benefit out of that movement. So we have this idea from a Western medicine, and of course Western medicine then says, if you're going to promote something, then you better prove it. You better have research evidence that says that's really what happens. So in the 1970s was the first research I could find. It was a single case study, ankylosing spondylitis, if anybody knows what that is. It's really your spine gets very rigid, and usually they're bent over like that. And that was one case, one Tai Chi practitioner who had ankylosing spondylitis wrote a little self-case study and said, I do Tai Chi and it helps me. That was the very first one, and that was in the 1970s. Well, then we had more groups of people giving testimonials, which again is pretty weak evidence in terms of the scientific method. But in order to do really good studies, you need research monies invested in it. So in the United States, we have the National Institutes of Health, which has large research monies to put into studies, usually from large institutions. But they weren't funding Tai Chi QiGong studies. Not right away. In the 90s, and then they began to. And then in 2000, 2005, 2008, as much as $20 million was dedicated to research in alternative medicine, alternative therapies, not just Tai Chi and Qigong, but it came under it. And now we started getting studies, and we started getting large institutions, thereby the Osher Research Center in Harvard Medical School, which is dedicated to research in alternative medicine. Those researchers, some of those researchers got a passion the way I was getting a passion and said, I want this to be my research agenda. Went to the NIH and said, would you give me monies so I can study this? But it takes a while for that to happen. It takes a while for the money to come, the little studies, then the bigger studies, and then multiple studies. Well, here we are, 2014, and now we're seeing the benefits. So it took, you can see how the history went. So now we've got research from Tufts University that says arthritis, decreased inflammation, pain management control, improved function, and reduced fatigue. Because pain and inflammation, there's always this fatigue aspect to it. That is well-respected research. We've got a number of studies in Parkinson's, for Parkinson's management. We're not talking about curing things. What we're talking about is managing existing conditions. So does Tai Chi cure Parkinson's? No. But individuals with Parkinson's, are they able to function at a higher level? Yes. Better balance, less falls, better control of tremor, less fatigue, greater ability to engage in life. From 17 minutes of exercise, which makes me feel good, which boosts my immune system, which has no side effects, which I can do anytime, doesn't cost really anything other than investing in your own training. Wow. That sounds pretty good. The study that I'm most excited about, and really it happened a few years ago, and you would think the rest of the world would be so excited about it right now, but it has to take time. It has to take time for things to happen. Came out of Sydney Medical School in Australia, where they've done a number of they've been investing money in Tai Chi research for a while now. They started out mostly looking at balance and fall prevention. But they were working with a group, cancer. Now this is a large study, a large randomized clinical control trial, very credible evidence, and so lucky, I think, so lucky so intellectually thoughtful. One of the outcomes, not just balance, not just fatigue, not just mood, was that they happened to look at an indicator of inflammation. And I remember I said I was going to get back to inflammation. C-reactive protein is an indicator in the blood of inflammation. And they just happened to put it into their research study. I suppose not just happened. I suppose they were pretty thoughtful about it. And showed a significant decrease in those who practice the Tai Chi. And this isn't heavy. Sorry, Qigong. But, and I should make that clarity, that if I practice Tai Chi as Qigong, I'm crossing the true for health. Gentle, slow movements. Qigong, and we're going to get into the Chinese model. Qigong, the basis is in Chinese medicine, is really energy cultivation, opening energy gates, the flow of energy around channels, meridians. And we can do that with Qigong that are strictly the medical application, or Tai Chi, which we know has a martial arts foundation, but can be done as Qigong. So they called it Qigong, but they had Tai Chi postures in it, as well as meditative and postures which were very similar to some of the exercise we do in the 24 posture Qigong. So they had class once a week or twice? Twice a week, and were asked to practice at home 2 or 3 times, and they kept a log. And these are seniors or individuals with cancer. These are not high performers. These are people brand new to it, and half the practice was at home on their own. And they had this reduction in inflammation. This is big, big news. If you know much about the Western model, inflammation is a precursor to illness. Cancer, that's why it was cancer patients, so they looked at inflammation. Heart disease. Those two alone are so big, but arthritis and all the autoimmune disorders that we're seeing, this big rise in autoimmune disorders, that's inflammation, is the precursor. So could we do something? Could we do a simple exercise and reduce the inflammation as a preventative intervention? That is exciting. That's going to take a little while. Okay. The researchers are going to, first somebody has to get excited about it. A senior researcher, and say, I want this for my agenda. Then they have to ask for the money. Then they have to go through the protocols. Then they have to do the pilot research, and then they do the full research. So it's going to take us about 4 more years before we see too much more about that. In the meantime, we're all going to do it. We know. We know already. Maybe the rest of the world doesn't know. But we can see the writing on the wall. This is pretty darn exciting. So that's the Western model. It's catching on. It's getting very exciting in the Western world. The Eastern model. The Eastern model is a belief that energy, vital energy, is our vitality, our health. We're born with a constitution. We're born with chi. We get chi from the nutrition. We get chi from the air we breathe. At the same time, we get stressors and we get toxin, which are threats to the chi that we have. So the organization of that chi in the body is not anatomical. You know, as a physical therapist, I did gross anatomy. And we studied the body and dissected it and looked at all the parts. I can't say, there's, whoo, look at that chi. Look at that vessel there. Woo. This person has a lot of chi. I can say, okay, there's the aorta, and look at that meridian. Oh, whoa, that's a great meridian chi path there, channel path. It's not part of our physical anatomy. I don't know, I don't really need to convince you that it exists. What I'm saying is this is the model. This is the model that has existed for 6,000 years in China. Energy is the life force. Qi. We're born with prenatal qi. We gain qi from nutrition, from our environment, from the grounding, from the trees, from the cosmos. My interaction with you, that's why a lot of us like, or we think that's why a lot of us like to do QiGong in a group because I can communicate and get energy from everybody in the group. So I have gates. How do I get it into my body? I have gates, big gates right here, which is actually has to do with cardio function. Laogong here. I have the same thing bubbling well in the soles of my feet, about the same point, the Yang Chuan point. I have a big gate at the back here called the Ming Men. So I have a number of gates down my spine. These are major, major gates. But then every acupuncture point, and there are 760 of them mapped out in Chinese medicine, I believe, that is a small gate. And then every pore in my body is a communication with my external world, isn't it? If you put some poison on my skin, it would communicate. It would come in and poison me. It's also, every pore in my body is a way I release toxins from my body. You know, if I eat French onion soup and I sweat today, I'm going to be sweating French onion soup. So it's a way that we clear toxins. So we know it's communicating, don't we? It's not far-fetched. It's not far-fetched. The construction of the 24 Posture QiGong uses major energy gates, as well as a belief in the energy field around me. There's a macrocosmic energy, which is really the cosmos and the grounding and the mountains and the rivers and everything that's around me, outside of me. There's a micro, which is my internal system, and then I communicate with QiGong, as well as adding my mind to it. So if I strike down, I'm smoothing my energy field. I'm smoothing my energy field, and that same theory is used in Reiki, therapeutic touch, quantum touch. When I move and shift weight on the floor, I'm stimulating different points, acupuncture points on my foot to stimulate organs in my body. Liver, kidneys, gallbladder, which is a much larger system than we think of gallbladder in an anatomical sense. That's reflexology. So that theory is used in reflexology. Acupuncture, acupressure, the mapping of the whole system. That has to do with energy system. We know it's not new, and now it's not really sounding all that strange to us anymore either. So when I do the movements in Tai Chi QiGong, I'm opening energy gates. I'm nurturing and cultivating energy flow, my communication with earth, cosmos, heavens, everything around me, water, trees, mountains. And that's how I maintain my health. Two totally different thoughts here, huh? One system is nebulous, I can't really see it, but it's as true and as real in traditional Chinese medicine as our belief in the theory of anatomical medicine and disease and trauma as we know it in the Western model. I got both. I got both working for me in 17 to 20 minutes a day. I've got everything. I don't know another investment in general health and wellness that can compare in terms of how much investment do I put in and how much benefit do I put out. So I guess after my search all around and studying with many very wise and very knowledgeable leaders, this is where I settled. This is what I got so excited, what I got so passionate about, and what I thank you for letting me to be here today, because I love talking about it and sharing with you. I hope you get as excited as I do about it.
Thank you.
Thank you. Thank you.